people tend to gravitate towards taking the path of least resistance. And if they're actually told by doctors that they can take these drugs and it will help with reducing pain, and the doctors do not really mention that they have to be very, very careful because they can become addictive, then I think that this explains why it's become such a huge problem. Opioids are very, very effective for reducing pain, especially spine-related pain, back, neck pain. So I understand why people take them, because nobody wants to be in pain. And chronic pain is something extremely debilitating. So when we talk about opioids, what we're talking about here, first we should understand the difference between opiates and opioids. Opiates are the drugs that are derived from the flowering opium poppy plant. And examples of these would be morphine or heroin. And these are highly linked with dependency and addiction. Opioids, on the other hand, are synthetic. They are made in a laboratory. They are designed to activate the same opioid receptors in our brains. And like the natural products, they produce similar feelings of pleasure and pain inhibition. Frighteningly, some of these opioids, these products that are made in labs, are 50 times more powerful than heroin. 50 times more powerful. So it's really easy to understand why these can become a huge, huge problem very quickly. The most common opioids that are being prescribed would be oxycodone and hydrocodone. And the one that has exhibited the biggest problem in America, and it's finding its way around the world, is oxycodone. And worldwide, there's another drug called fentanyl, which is pretty much becoming the biggest problem when it comes to these opioids in the world right now. When we look at the opioids that are available in Singapore, the list is extensive, and you can see from that list there. I'm not going to go through them all, but you'll certainly see some names that you recognize, whether it's the official name, hydrocodone, vicodin, or oxycodone, which is called oxycontin, demerol, codeine, tramadol, fentanyl. You've heard all of these. Heroin is on that list because there is a heroin problem in this country, although it's not prescribed. Anyone that takes opioids is in danger of developing addiction. Anyone. When we think about what is it in these opioids that creates the highs, that creates the addiction, it's morphine. And all these that you see there, they are all made from morphine. And it's very, very difficult, almost impossible to predict who is going to be more vulnerable to becoming dependent on these drugs. I think to myself, I sort of think that the elderly are probably more at risk because they tend to experience more pain. And whether these are taken legally or illegally, because there's a huge illegal trade of these drugs now, these drugs are responsible for most of the overdose deaths today in the world. Just recently, I read that there was 18 kilograms of heroin was recently detained on the causeway coming into Singapore. So we know that there is a problem on the streets with these drugs. So we really do need to be on our guard, and we need to be very mindful of our family members. Let's think about what addiction is. It's true, no one ever really plans to become addicted, but it's a condition where something that started as a pleasure now feels like something you can't live without. And experiencing less pain is certainly considered a pleasure. If you've had a lot of pain, then it really is pleasurable to find relief from this pain. So that's why people very easily become hooked on these drugs. No one ever plans to become addicted, but it happens. It happens all over the world. Doctors will define drug addiction as an irresistible craving for a drug. So you're just craving it. An out of control and compulsive use of the drug and continued use of that drug despite repeated harmful consequences. So you know it's doing you harm, but you just can't stop taking it. And you know why are they so addictive? Because they activate powerful centers in your brain associated with reward. So you really do feel good. You know, you feel rewarded when these drugs hit your system. They have a very high addiction rate, and for people that take them consistently for as little as a couple of months, 30% of these people can find themselves in a state of addiction. So it really, really is a high addiction rate. What's happening inside us with these drugs? Well, these opioids, they trigger the release of endorphins. Endorphins. What are these? These are the feel-good neurotransmitters. So these are hormones within the brain that make you feel good. They muffle the perception of pain. So they dial down pain while they're boosting pleasure. So they're dialing up pleasure. So they're dialing down pain and up the feelings of pleasure. And this creates a temporary but powerful sense of well-being. And when you've met somebody that is addicted to these drugs, this addiction is extremely, extremely powerful. And when I think about, since I have been in Singapore, I've been approached on a number of occasions by people that know that I've got doctor before my name. They don't realize I'm a chiropractor. They just see doctor, and they ask me, can I supply them with opioid drugs? And you know, they're looking for a fix. And so I know there's a problem out there, and I know people right there that would love me to be able to supply them, but that I never would. So they produce this amazing sense of well-being, but when this feeling of well-being wears off, then you want those feelings back, and you get this feeling of loss. And this really is the first milestone, if you like, on the path towards potential addiction. You have a high, you low, you want your next fix. This is the pathway to addiction. So please, if you or your family member are currently taking any of these prescriptive opioids, and remember these names: oxycodone, fentanyl, methadone, vicodin, tramadol. These are all opioids. They're all highly, highly addictive, even if you haven't been told they are. So please take note. When you take these opioids repeatedly, what actually happens is that these endorphins that our body produces, they're downregulated, which means if you're taking these drugs that produce these endorphins, your body feels the need to produce less of its own endorphins. So you then get this huge gap and this huge void that you really need to fill. So, and this is why the whole need for taking them gets dialed up. So what's happening is that the more you take, the less your body produces. So the more you have to take to make up for that loss. And so this effect is called tolerance. Tolerance. Your body becomes tolerant to the drugs. You've got to keep taking more and more. Hope that makes sense. So what are the other effects of the opiates? We know that they reduce pain. We know they make you feel good, but they can also have other very dangerous effects. And this really is, cause for real concern if you or a loved one is on these drugs. In lower doses, they can make you feel drowsy or dizzy. You can get some sickness, but in higher doses, then they can really, really affect your bodily system. So your breathing, heart rate, they can all be really slowed down to dangerous levels. And this is why they are so dangerous. Just so you can get a picture of what's happening, this is the way it works. You are prescribed an opioid, you use it, you find relief. You keep using it and you find that you have increased use. So your body starts to tolerate it. So you take more, increased dose. Your body learns to tolerate it even more increased dose, then you become dependent. And once you've got that dependence, you are then addicted. And that addiction is likely to manifest in withdrawal symptoms. And if you've ever seen somebody suffering from withdrawal symptoms, you know how serious it is. They can experience sweating, anxiety, insomnia, hyperalgesia, so increased levels of pain. So what started as something that would decrease pain, now you've actually got increased levels of pain. And then something called anhedonia, which is the inability to feel pleasure. So you've just got this, you're just totally addicted. You can't feel pleasure without a hit. Very serious place to be in. Back to who is most at risk then, I think, well, we know statistically that people over the age of 45 are most at risk of addiction and overdose. The problem here is that this addiction problem is actually very, very difficult to detect and treat, to diagnose. People just quietly get on with it. They're taking more and more. They don't even know that they're getting themselves into trouble until it's too late. And what has really, really brought this problem, accelerated this problem, is literally the liberal or lax use of medical doctors in prescribing these. And I really don't think there's been enough care and due attention and empathy as these dangerous drugs are prescribed all over the world. And remember, the elderly quietly suffer pain, and you know, they may not really understand what they're taking. But these medical doctors, I do know that sometimes they are rewarded by drugs companies for pushing various drugs, and I have no reason to think that this is any exception. So it's a pretty dangerous situation. While medical doctors' intentions would be mostly good, the long-term effects of prescribing these drugs can be catastrophic. And it's not just an American problem. You know, we know that we see a lot of TV, and we know that there's a lot of drugs problems on the streets in America and other countries. This is Singapore, we're safe here, right? Actually, no. There's more and more finding its way onto the streets, and these drugs are being prescribed by medical doctors here. And actually, in a 5-year period, the per capita consumption of opioids actually doubled in Singapore. The stats I've got between 2005 and 2010, this opioid prescription doubled, and I have no reason to doubt the fact that since then it has continued to increase and increase and increase. Certainly, that's what the drugs companies would like to happen, because they like it when people get addicted to their wares. So let's think a bit more about these opiates. Where do they come from? Well, you're probably aware that opiates are made from this milky substance that's inside the pod of a poppy plant. The opium plant is a poppy plant, and it's been around for a long time. The earliest known cultivation of these opium poppies is over 5,000 years ago. The ancient Sumerians, which is modern day Iraq and Kuwait, actually referred to the bright red poppy flowers as Hulgil, the joy plant. And I think we know why they give you joy, right? Because they bring up this feeling of contentment and pleasure. These ancient societies used opium for all sorts of things. They used them to help people sleep, to relieve pain. We know that. But even they even gave it to their children to calm them down. And I think that was probably setting the stage for some real problems. When we look at Singapore, Singapore's got a really rich and, dare I say, beautiful, dark history of opium use. This is a picture of an opium den in Singapore, 1941. This was probably down by Singapore River, I would imagine. If we go back to the 1800s, smoking opium was so normal, it was legal, and it was so accepted in just daily life that people would offer a smoke of an opium pipe just like you might offer somebody a cup of tea. And it was literally so common that when there was a population of less than 100,000 back in the 1850s, almost 20,000 people of that 100,000 were actually opium smokers. So it was pretty endemic. I'm embarrassed to say that the British government actually earned enormous profits from granting opium licenses. And back at the turn of the 20th century, so back in like the 1900s, early 1900s, the colonial government earned half of its revenue by giving licenses for people to supply opium into Singapore. Frightening, eh? It wasn't actually until 1934 that opium was actually banned in Singapore, unless it was by a medical doctor under prescription. But later on, just after the Second World War, there was still nearly 20,000 addicts, confirmed addicts in Singapore. So it was stuck in society, and there was this illegal trade going on. People ask me, what's the difference between opium and heroin? Is it the same thing? Well, it all starts with the poppy plant, and morphine is extracted from the poppy plant. So the opium plant is the poppy plant, and they extract morphine from it, and then that morphine is then synthesized either into heroin or into all those other drugs that we've mentioned. When I look at history, it is quite sad, but it's quite amusing at the same time. Here, look, this is an advert from 1901, and this is heroin. And what does that say there? The cheapest specific for the relief of coughs. So, we can see how times have changed. Here, this is a medical advert from 1901, heroin as cough medicine. Another one here, this is March 1885, cocaine toothache drops. So cocaine is actually prescribed or advertised, instantaneous cure. It says right there, instantaneous cure for toothache. I'm not surprised it's an instant cure, but my God, the damage it must have done. So when we think about all these dangerous drugs, they find them way onto the street. And I think we can understand that worldwide, there's an enormous trade worldwide. And you probably, when you watch these, especially American movies, you probably recognize a lot of their street names. We can see some there. Patch, that very often refers to fentanyl, because it is actually prescribed. They give you patches, and it finds its way into the blood by patches. Oxy is oxycontin or oxycodone. You might have heard of red rockets, or chill pills is tramadol. They've all got their names. Cody is codeine. They've all got these interesting names, haven't they? As far as coming into Singapore, fentanyl is probably the biggest problem worldwide when it comes to these these opioids, and it has reached the streets of Singapore, and they have intercepted a few shipments now, and I've seen it mentioned in the newspaper a couple of times now. And why is this really important? Why am I mentioning this specifically? Well, fentanyl is extremely easy to overdose with, and obviously it's probably got the most fatal rate worldwide now, and that is fentanyl. And fentanyl does not sound as dangerous as heroin, does it? But it's killing as many people. So I want you to be aware. What you should look out for, so these are the common signs that yourself or maybe a loved one or a good friend may be developing a problem. Look for these signs. So if somebody is asking for an increased dosage from their doctor, that would be a sign. If perhaps they're doctor shopping, so they're looking for medical professions that are willing to give you a higher dose. I'm very aware, and people have asked me, if they are finding an inability to control or reduce their use. So you get on these things, but really you want to be finding a way off them. And if you can't get off them and you're not able to reduce them, then you're heading towards a problem. If someone is attempting to obtain opioids from illegal sources, obviously this is a sure sign that there's a problem building. And then if there is an increased need to take them to get the same effect, again, this is a sign of a problem. Withdrawal symptoms when you stop or reduce, if somebody has depression or nausea or it could be muscle aches or insomnia, can't sleep. These can all be signs of addiction. And then if you're aware of somebody having more problems at work or more antisocial interactions with family members, or there's problems at home, this is something that could be a sign that there's an underlying drug problem coming to the fore. I think the most important thing is that you recognize that there is a problem, and if anybody is experiencing this problem, try and get professional help as quickly as possible. That is really the most important thing. I'm going to give you a phone number right now. This will be one to remember. If you or anybody you love is at risk, recognize it, acknowledge it, do something about it. There is a problem. Take down this number, call the NAMS. This is the National Addiction Management Service. There's the number right there, 6389 2000. Okay, but the most important thing is recognize it. Don't sweep it under the carpet. Don't stick your head in the sand, because this is a problem that will only get worse. So I'm coming towards the end, really. There's a few more things I want to talk about. One, just remember that opioids aren't meant to treat chronic and spinal pain. They do not help your body heal. They become less effective at stopping pain the longer you take them. So if they are used, it has to be very, very short term. And as soon as you start taking them, you've got to start thinking about getting off them. And instead of building up a tolerance and putting yourself at a risk of dependence, there's only one smart decision to do, and that's to explore other treatments. I understand pain is something that you've got to get off, so you've got to find other payments. And this will then bring you to, why am I so passionate about this? Because I've helped people get off these things in the past, and I know that chiropractic works. So let's think about it. Movement-based treatments. So as you get movement back into the body, there is a neurological reflex that actually inhibits pain. So you have to incorporate it. Lying there in pain, taking drugs is not the answer. We've got to get movement back into the body as quickly as possible, because that will actually go a long way to inhibiting pain. Why is it that if you hit your thumb with a hammer, you shake it and the pain diminishes? it's simply because movement inhibits pain, right? And what does chiropractic do? It helps bring the movement back into the body. So let's just think about chiropractic adjustments for 1 minute. Pain is usually associated with some loss of function, right? Chiropractic is all about restoring function, right? The body can only get back to normal when function is restored. And by that, I mean alignment and movement, normal biomechanics of joints. And we know that it's altered biomechanics or movement patterns that we go through during our daily basis. It tends to be common with all people dealing with spinal pain, right? Spinal pain is what we're talking about here. So what's chiropractic doing? Well, I can list it off there. We are restoring motion, which reduces pain, as I've just explained. By that, it will actually inhibit pain. We are improving blood flow to the joints. Blood is the communicator. It's the delivery system for the body. It delivers the nutrition, the oxygen, the chemicals of repair. And at the same time, it's taking away the bad stuff, the products of metabolism, the lactic acid, all these chemicals that build up that will increase inflammation and increase pain. What else is it doing? Chiropractic releases endorphins. We've spoken about that. And of course, these are those feel-good hormones. And this is why many of my clients tell me that they're actually feeling a little bit addicted to their chiropractic adjustments. And that really is because they like feeling better. They prefer having less pain, better function, but there's also more endorphins running around in their blood. Chiropractic will reduce pressure on nerves, therefore reducing pain. It will, with a program of adjustments, your adjustments will reduce fibrosis, scar tissue formation, increase elasticity. So that tightening, that stiffening that's associated with pain and premature aging is all diminished. And pretty much all our chiropractic adjustments will provide testament to that. Obviously, we are improving posture, alignment, and we are facilitating healing. So, there is a lot going on inside the body. So really, what we do, it's all about quality time, helping people get the best out of lives, which means living life without pain in a natural manner. I tell people that chiropractic is for everybody. And in our clinics, we see elite athletes that don't have pain, but they don't want to get injured. We see lots of people who have pain, and we help them reduce their pain and then live at a higher level of function and with less pain. And so wherever you are in life, chiropractic will help you. It's just whether you want to incorporate it. Whatever you do, please think about your posture, think about movement. Movement actually is life. And what I'm talking about is we really want to be smart. We want to find safe, long-term strategies for a healthy life. And that pretty much is, that's what we're talking about here. So I've gone through quite a lot of stuff there. If anybody has got any questions for me, it doesn't have to be it doesn't have to be about opioids. You can ask, take this opportunity to ask me any question. I can see somebody's there saying, "Oh my God, my wife is using it." Well, just be very, very careful. Please remember, these are addictive. Talk to your medical doctor. Whatever happens, do not let it become an increasing problem. Remember, when you're on this stuff, you should really be trying to get off it. Okay, there are alternatives, and you should always be looking for something more natural. Okay, something that is sustainable long term. Okay, so if there's any more questions, I'll hang out here for another few moments. But otherwise, thank you so much for listening. Please, if anybody needs to come into our clinics, you can find your way. It's very, very easy to find your way into our clinics on our website. There's our website right there. You can email me. I do not hide. I answer all emails. So we are here to help. So if anybody has got any questions, then please don't be shy. I will do whatever I can to help. Okay.